Kern County Public Health Department says the county now meets the requirements to be moved up to the next COVID-19 tier.
Tim Johns breaks down Kern's most recent numbers and tells us what moving into the new tier could mean for our day-to-day lives.
Today, Kern County is meeting all the state's requirements to move into the next tier, the red tier. In fact, we were meeting red tier requirements yesterday.
After weeks of waiting, Kern Public Health saying Thursday that the county has finally met the state's requirements to move us out of the most restrictive COVID reopening tier, something that we had been failing to do as recently as Tuesday.
Moving into the next tier allows increased indoor activity for our restaurants, our gyms, our places of worship, our schools, among other activities in our community.
Now, to be clear, that doesn't mean we're automatically moved. The state only evaluates data every Tuesday, so our numbers will have to stay within the target range until then. On top of that, there's also a 2-week transition period we'll have to go through before we officially move from the purple to the red tier.
Kern needs 563 more tests per day to meet the state's median testing rate and not experience the artificial adjustment to our case rate.
Testing was one of the key areas that Sacramento told Kern we were lacking in, with our median rate being below the state's average. That's why even though we've hit the necessary metrics for now, health officials are encouraging everyone to go get tested.
It is important to remember that testing is also a very important resource to slow the transmission of this disease in our community.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.